This is Dr. Mohsin Kayam at Progressive Behavioral Health. I'm very excited about today's videos. About a month ago, we did an introductory video for Dr. Svetlana Sambrano, who is a child and adolescent psychiatrist in Friendswood. And it was very well received by our patients and the community that we serve. So our effort and the goal is to introduce all the providers at Progressive Behavioral Health through this video series. Hopefully after we have finished the introductory series of introducing all the providers at Progressive Behavioral Health, we will also launch a clinical series in which we will discuss different healthcare topics and clinical topics for our patients. And the goal will be to serve them in terms of their clinical needs and any questions they may have. So in today's video, I'm very excited to introduce Samantha Coy.
Thank you.
Samantha is a licensed psychotherapist.
Yes.
Very accomplished.
Thank you.
Very well known in the community.
Thank you.
Brings a lot of expertise, clinical, management, administrative expertise to our group. So we are very happy to have you here at Progressive Behavioral Health and be a part of our group practice. So welcome.
Thank you so much. Thank you.
So in today's video, we want to spend a little bit time on your background and your inspirations and your clinical background. So let me start with my first question.
Sure.
So tell us a little bit about your background so the patients will know a little bit about you and who you are. So we'll start with that.
Definitely. Thank you so much again for having me here today. I'm also very honored and very excited to be part of this group. My clinical background is I received a bachelor's of science and psychology from the University of Houston. So I am born and raised in Houston, which is not common nowadays. And I have a Master of Science in Clinical Psychology with a specialization in marriage and family therapy from Our Lady of the Lake University. I also was a clinical director of an outpatient clinic, and for many years worked at a psychiatric hospital with patients with acute severe diagnoses. So I've definitely seen the spectrum of different issues that are going on in the community. For me, my area that I really enjoy working with is, children, adolescents. There's a lot of need right now in that particular area. But the demographics that I focus on the most is, 3 years old to 90 years old. It really, for me, anyone that needs help, I'm there definitely. And I'm also fully bilingual.
Excellent.
Yes, so definitely fluent in Spanish. My family is actually from Mexico, so I definitely understand the culture as well as speak the language, which I know is very difficult to find somebody with that expertise. But yeah, definitely for me to be a part of this team, it means so much.
Thank you.
Yes.
And being bilingual is a big asset because the Hispanic population is increasing.
Yes.
I do see patients who are primarily Spanish speaking, and sometimes it's very challenging to find a therapist who can speak in their language and understand the issue. So it's very important. So that's also an exciting thing for us.
Definitely.
So let me move on and ask you what motivated you to become a therapist?
And that's actually, for me, I get asked that a lot, and it's one of the questions that really, really keeps me focused and centered. And it kind of ties into the question you asked previously about, being fully bilingual. Probably about 8-9 years ago, my mother had cancer, and while we were going through the process, I began to see that there really wasn't someone there that could talk to us about what was going on. We did meet a lot of social workers, but never anyone who, was Latino and understood kind of what we were going through culturally, and also to be there to give us family therapy. So that was my inspiration, is I don't want anyone to have to go through that alone. And so that really kind of pushed me to go back and get my master's. And I'm not sure if I had mentioned, I have 3 clinical licenses. So I have one specially for marriage and family therapy, I have another one in licensed professional counseling and one as a national certified counselor. So that really kind of allows me to, kind of explore all the different, avenues that we have for therapy and not really be tied to just one. And it helps, I think, as far as, being interpersonal and also interdisciplinary as well, as to kind of understand all the different angles of what's going on.
And I think so you can treat all populations, including children.
Yes, most definitely.
So that's excellent. Tell us what motivated you to join Progressive Behavioral Health?
Where do I start? there's so many reasons. For me, finding a place that I felt comfortable, that matched, my kind of outlook on life was super important. And from the second you walk in the door to when you leave, you can feel the energy. Everybody actually, smiles and takes time to say hello and knows so much about the patients. I've never really experienced that anywhere else, and that was a really huge motivating factor. And I know that, I've definitely heard of Progressive Health. They have such a great reputation.
Thank you.
Yes.
Thank you.
Oh my gosh. Yes, definitely. And also, having known you professionally, I already knew kind of what your philosophies were, your outlook, your bedside manner, everything that goes
Thank
into,
you.
yes, really caring about the patient. And that was my motivating factor, definitely.
No, I think the key thing you mentioned is environment. So work environment. If it's a pleasurable and exciting environment, then people will be more productive. So the same thing applies to our personal lives as well. So we want to keep our environments healthy. We want to keep our personal environments fruitful and healthy and rewarding. So we want to translate that into our practice environment as well. And I think I mentioned it in my previous videos that we are hopefully by the beginning of next year we will move into our new location in Friendswood. It's a brand new office location with more space and a much better location in the heart of Friendswood. So we are very excited about that, and this is a first step towards the goal of expanding it further. We have a brand new location in Baytown, which is already running and serving clients and patients in the Baytown area. So that's excellent. So tell us a little bit about the modalities of therapy that you implement and the type of psychotherapy that you provide for your patients.
Sure. That was another kind of motivating factor, is my philosophy and my beliefs about the way therapy should be employed. I saw the Progressive Health matched up where, we put the client first. It's typical in this day and age to go through the medical model, where the doctor's always right.
Yeah.
The therapist is always right. And it may be that, sometimes that does happen, but for the most part, the client's the expert. And so I employ what we call postmodern therapy, and that is called collaborative therapy, solution-focused therapy, and also narrative therapy, where together we're going to work to deconstruct the issue, and we'll come out with ways to solve the problem that maybe have always been within the client and the patient. They just, unfortunately, sometimes it's hard to see those things. And I always try to empower the patient, which at Progressive Health, they do that. That's super important to me, definitely.
So patient-centered, empowering
Yes.
them,
Yes.
making them lead the way in terms of finding solutions.
Yes.
And that is in a way a cognitive restructuring, but more led by the patient.
Yeah, definitely. And I'm eclectic, so I'll definitely use cognitive behavioral, person-centered. There's some psychoanalysis that informally we can do as well. But I try to use what the patient needs. And so that for me, I feel is different. It makes me unique because I don't want to do a one-size-fits-all type of therapy. I want them to come in and us get a feel kind of what their needs and their wants are, what the goals are going to be, and then using my clinical expertise, we can guide that. Definitely.
Yeah, that's certainly I can vouch for. Also, the feedback that I've received about Samantha is that she's very personable,
Thank you.
listens to the patients, listens to their issues and their problems and kind of directs them in the right direction without taking too much charge, but also staying involved, which is, I think, is very important.
Definitely.
Sometimes you hear from patients that they never heard anything from the therapist never said anything. So if it's a combination of both, which is enlightening to the patient, I think it's a very practical approach. So that's excellent.
And you're right, I hear that a lot, the therapist just sat there and they didn't really talk to me and they didn't give me information. And, that's a piece where if we can all work together, things, like you said, they feel better, you get a grip on things quicker. And that's the other thing I wanted to mention is, postmodern therapy, they want the briefest therapy as possible. So we want to give you those tools to cope with life. We want to give you those kind of aha, enlightened moments, and hopefully do it, sooner than later. So that's really important.
So along the same line, so what makes you different? Because people have choices in today's world. They have a choice to see a different counselor or a therapist. So what makes you different? I guess what makes you click with your patients and makes you a better counselor in this field?
That is a very good question. And I think the best way for me to answer that is to use a comment that one of my patients told me today. He said that typically when they go and they meet with therapists or doctors, that they feel like they're just numbers, or they feel like the person really is not listening to them. I think what's unique about me is that, if I have to write something down, I'm not going to do it right when the person's giving me, a piece of their treasured life that they haven't given anyone. And I want them to know that they're important, they're number one, they're my main focus at that point in time, that everything else doesn't matter. And he told me today that he always feels that way. So I'm going to use his words, that he feels that I truly listen, which I do. And I love actually sitting down with people and listening to their stories, because everybody has such an interesting story. The way that we see things is all shaped on perspective. And it's just so fascinating to hear, the motivations of people. That to me is what I feel sets me apart from the rest, is I truly do want to know, why do people make the decisions they do?
And, some patients who are coming to our practice have seen the office. But if you have not seen her office, it doesn't have any computer or any desk where she's taking notes and just focusing on the computer and not even looking at the patient.
That is true.
So it's very important, because this is an important time for the patient. The patient is there for a very important reason. And they want to at least get a recognition that their time is valued.
Exactly.
So that's very important.
Yes.
So what kind of conditions do you specialize in, and what populations do you serve? Well, you initially mentioned that you can see all spectrum of ages, but what kind? Are there any specific conditions that you focus more on versus others?
Yes, most definitely. So for me, having worked so closely with the adolescent population, and also with the children, the pediatric, anywhere from 3 to 18, that's where I would consider to be, my area of expertise. Self-harming behaviors, eating disorders, problems with social skills, anger management, a lot of depression, anxiety, just overall being able to acclimate to the different environment right now. As you guys know, teenagers and children have it so much harder than we do. The social media aspect is there. It's just, they're up in front and center of everything, which just completely changes the whole pattern of behavior, so to speak, than what we're kind of used to. So for me, that's, the group that I connect the most with, and I feel like I can kind of put myself in their shoes. And the most important part is I feel like they feel it, which is a big piece of it. And so that's my area, that I want to focus the most on.
Excellent. And at the end, I think I can announce it on this video, is that Samantha started in our Friendswood location. And the address is 341 East Parkwood Avenue, Friendswood, Texas 77546. And as I mentioned before, we're going to move to a new location, which we will announce through a video as well, and on our website and through various different venues. But she also indicated to me today that she will be starting in our Baytown location, where there's a lot of need for psychotherapists. It's very hard to find a good psychotherapist in this area. And that location is 1113 West Baker Road, Baytown, Texas 77521. Our website is www.progressivebehavioralhealth.com, and our number is 281-993-3733. Please visit our website. We'll post this video on our website. We'll post it on our social media, Facebook page. Please call us for any questions. If you need a therapist, do call us and make an appointment with Samantha.
Yes, definitely.
So we are very excited to have you. And thank you again for your time.
So much.
Appreciate it.
Appreciate it. Thank you.